So a prescription writing requires name of the patient, age of the patient. What else that's important?
Name of the drug.
Name of that drug. Okay.
The timing to take that drug. Frequency.
Timings. All right. Timings means
Doses.
doses. Yes.
Any other consideration like take it before or after meal?
All right. Special conditions or special considerations before meals, after meals. Yes.
Allergies.
Allergies, very important. Good.
Dates and time.
Date and time. Right. Yes. Date and time, obviously. Yes.
The duration for how long the drugs should be taken?
That's very nice. Duration for how long the patient is going to take the drug, whether it be of 1 week or 2 weeks or 3 months. That's great. Okay. Good. So we need to start off with the prescription. First of all, the identification, and we'll see what are the components in the prescription writing that you're required to do. A prescription is a written, verbal, and electronic order from a practitioner to a pharmacist for a particular medication for a specific patient. So it is very individualized. It is individualized. You should know that it's actually an order from a practitioner, so it's a huge responsibility. And it is ordered to whom? To the pharmacist. It can be usually it is to the pharmacist for a particular medication for a specific patient. So it should not be a generic thing. So it has to be very specific and tailored for each patient. So the identification in the prescription is crucial, number one. Number two is its legitimacy is also very crucial, that you need to know that the patients doesn't get confused with it. A pharmacist doesn't get confused with it. If it is electronic, the confusion is less, but in electronics, the typing error, maybe the typing error could be a possibility. And if you are writing it down from your hand, it's also it's going to be a risky thing. Okay, prescription, you started off with a Latin word, and when you write prescription, you use this abbreviation. Drugs that requires a prescription because it is considered potentially harmful if not used under the supervision of a licensed healthcare. So it is very important to know that why you are going to write the prescription. And who can write a prescription? Physician, vet doctor, and dentist. These are the persons who are authorized for it. Prescription format. Prescription has heading, which we talk about the upper part of the prescription. From if you go from head to toe, you started off with the headings. Headings include the demographic data. Heading includes maybe the allergies, the date, time, patient record, and all of the informations or the means of identification of the prescription. Body is the actual thing that requires that has medications, which kind of medication, duration, frequencies, special conditions whatsoever. And then there is a closing remarks of closing could be because closing by your follow-up. Sometimes they also write follow-ups on the prescription, and sometimes they write the duration also for the whole body, and it is also closed by signature. So heading, it includes name, address, telephone number, name, sex, age, date of the prescription. So all of the identifications that are required. Body has you started off with this symbol, then name of the drug, dose, size or concentrations, directions to the patient. So it also requires, it also includes directions to the patient, pre-meals, post-meals, for how long. We usually use the generic name. Multiple drugs per prescription can lead to confusion, so keep it simple. So you need to be very simple and legitimate while you're writing a prescription. Avoid abbreviations. Many drugs identified abbreviations. Only use um, the standard abbreviations. HCT is for hydrochlorothiazide, MSF4 is for morphine sulfate. But usually you should avoid these abbreviations because it may lead to confusion. And no, everyone is not aware of these internationally, even the internationally recognized abbreviations. So it's good to write down the whole of it. The thing is, if whatever drug you are prescribing, you should start off with what is the type. Is it a tablet? It is denoted, it will be denoted by tab. Capsule, it will be denoted by CAP. Syrup, it will be denoted by SYR. Suspension, SUSP. Injection, ING. So by looking at that, you will realize that, okay, the doctor has prescribed me a medication, which is a tablet or a capsule or a syrup or a suspension and injection. Then the dose or the concentrations, decimal points, make it clear. Avoid using 5.0. Obviously 5.0 sometimes confused by 50. So 5 milligrams and 50 milligram is a big, huge difference. And if you wanted to use the decimals, try to use it before it. You can use it. If it is 0.8, you should use it 0.8 to make it clear, rather than using just 0.8, because it can be missed or it can be treated as 8 ml. So 0.8 and 8 is also a huge difference. So you need to take this in consideration. Rules for writing quantity of the prescription. So quantities of 1 gram or more should be written in grams, like write 2 gram, okay, because it is 1 gram. And the quantities that are 1 milligram should be written in milligrams. For example, 100 milligram rather than 0.1 gram. So if the quantity is greater than 1 gram, so you will use the word, use the decibels as grams. But if it is milligrams, don't try to convert this into grams. You don't need to every time standardize the concentration. So if it is in smaller units, try to use these smaller units, because it is more legitimate and it is more safer. 100 milligram. But obviously you need to be very careful while you're using it milligram or gram. You should be sure that not 100 grams, it is 100 milligrams. And you don't need to convert it into 0.1 gram. Although 0.1 gram and 100 milligram is one of the same thing, but 0.1 gram we usually don't write it because it's going to create confusions. So whenever you're writing it, you should know that whether my drug is available in the grams or a milligram. If the milligrams, I should use the same decibels and the same numbers. Quantities less than 1 milligram are written in micro or nanogram as appropriate. So do not abbreviate micrograms. Use the whole word 100 micrograms, not mcg. All right, or not 0.1 milligram, 100 mcg, 100 micrograms. So don't use this micro abbreviation. Use the whole or nano abbreviation or micro abbreviation. Use the whole of word 100 micrograms, the whole language, so that it's not going to be misconfused. Used ml or ml for milliliters. So you observe here in the prescribing the medications, you first need to know, you first need to be clearly demonstrate or clearly visible that the drug you are giving to the patient is capsule, or what is the type of the drug, then what is the unit of that drug. If you're talking about strengths, milligrams, grams, micrograms, nanograms, and then you should have these rules applied on that. Then obviously directions for the use. Write it down in the full English word or our Latin abbreviations, more convenient and more potentials for mistakes. Avoid dangerous abbreviations, provide clear and specific directions. So obviously the direction should be very clear and specific. So these are the abbreviations that we use it. BID is what? Twice a day. CAPS means capsule. QID means 4 times a day. You can also write 4 times a day or every 4 hourly. Q 4 hourly, every 4 hourly. All right. QID 4 times a day. Stat means immediately. Tablet or TID. So here it is written the formats of the medication that you are giving to the patient, and also the timings. So obviously if you're writing BID, obviously BID, you don't expect the patient to remember this BID. BID can only be comprehended by pharmacist. So if you don't know, or if you're not sure that probably the patient is going to understand this or not, because at the end of the day, patient has to take this medications. If he has a prescription written BID and he does not know what is BID, then obviously pharmacist will not come into the home and explain to the patient. He should have, actually theoretically speaking, he should have explained it while he's taking the medications, but you're not really sure whether the patient is going to remember that or not. So BID, you can use BID, but it is better that you use twice a day, because twice a day does not does not have any confusion in it. However, on the basis of patient's language, you can also write in Arabic or whatever language is comprehensible by the patient. So twice a daily, or in English or Arabic, whatever it is, or by symbols, you can put it down to 1 plus 0 plus 1 as a symbol for BID. So, and QID means 4 times a day, Q 4 hourly, Q 3 hourly. What is PRN? PRN is as needed. All right. So these are the abbreviations, important abbreviations while you're using the prescription writing. Closing, close by prescriber's signature, refill instructions that the patient is going to come at this time as has to refill these, generic substitution instructions. Then we come on to the controlled substances, which are regulatory by the drug authorities, and it has the potential of getting misused. These controlled medications are heroines, opioids, as morphine, diazepine, phenobarbital. These are all controlled medications, so you need to be very careful. Not all of the physicians are authorized to prescribe these medications. So you need to check with your institution whether your prescription is authorized or not before prescribing these medications. And you need to be very careful, because these medications can be used as a substance abuse. So make sure that you write it very clearly for the specific conditions and for the specific time. The patient cannot take it the whole life. How you are going to prescribe these controlled medications: be completely written in the prescriber's handwriting and ink, be signed and dated, carry the prescriber's address, carry the name, address of the patient, state the total quantity of the drug or the number of the doses units to be disposed in both words and figures, state the exact size of each dose in both words and figures. So you need to carefully administer the medications, and you need to carefully write down the name and the address of the patient. So if a pharmacist or a drug authority would like to contact this patient, he or she would be able to easily contact it. Number one. Number two is you should also be very clear while you're writing a prescription that you should write down what is the exact dose and for how long the patient is going to take this medication, so that he don't misuse these medications. Okay, so it's a normal prescription which is like this. It has, if you see here, what do you see here? What do you think that what is this written? If you see from up to downwards, what do you think that it is written? What is this?
RX.
RX. Okay, what is this?
Date and time.
Date, yeah, date. This is actually probably the date. And what is this now? Now we don't have any idea what kind of medication it is. It seems like that you must be expecting some medications. It seems like that this is the number 21.2, but still you can't really have an idea what kind of medication does he have. And oh yes, and then we have a sign here. So technically speaking, it does have a heading, it does have a body, it does have an ending, closing some remarks, but this is not legitimate. It's not at all visible. It's not at all readable from the patient, nor from the pharmacy. If there are some code words, you probably pharmacist can read it down and pick that up. So that is it. Okay, now if you see here, this, the clinic name or the patient doctor's name. This is the uh, the the first part, which is the identification, followed by this. Then it is written amoxicillin 100 milligram per 5 ml suspension. So now you know that you can also write this suspension in the from the beginning, so that you once the pharmacist is reading, he will know that okay, now I need to give him suspension, a liquid. And it is written also the quantity. All right, take 1 tablespoon TID for XYZ days. All right, so the strength is written, the strength is written, the dose is written, the frequency is written, for how long he's going to take it. And it is there from down, it is also mentioned that how are you going to mix and how are you going to prepare this for 60 ml suspension. And total 2 bottles are required from the physician, so it's an order to the pharmacist. Okay, and this is the closing sentence. Here you have the license number, signature, physician signature, name, address. And if you see here, it is age, sex, date. Although there are no allergies mentioned here, you should have an allergy mentioned here. You can also have one kind of a triangle here, which also can write the diagnosis, that okay, this medication, the doctor is giving this medication for what. So you can also add these things into the into your prescription. It's a good idea to add allergies, and also the diagnosis, so that a pharmacist should know. If the allergy is not known, you can write allergy is not known. If the allergy known, that's good. So it is also advisable to add these things. Okay, so if you want to summarize this prescription writing, what are the components that are required into the prescription writing? What are the 3 things that is there?
Heading,
Yeah, heading, good. In the heading, what is present?
the name of the patient, age, and allergy and diagnosis.
Allergy. Okay, all right, so identification. And then
Then the body,
the body. The body has, what are the things that the body should have?
the abbreviation RX,
Uh-huh,
and the name of the drug,
good.
the dose, the type of the drug, tablet or capsule or suspension,
Yes, good.
uh, the dose, for how long,
Mm-hmm.
and the instruction to the
And
patient.
instructions.
Yes.
Yes. And instructions. So for how long the patient is, and then the third thing is
Closing.
closing. All right, so you need to close it by signature or a license number, whatever is required from the institution in order to close your prescription. All right, you can also add here allergies and the diagnosis in the beginning. All right, okay, so That's about prescription writing.